Thursday, everyone. This is Dr. Greg Campbell, and welcome to Two Talk Thursdays. This is episode 2. Last week was pretty successful. We had, I think, over 4,000 views on the video, so I'm very grateful for that. And today we're going to hopefully build on that and answer some of the questions you might have regarding your dental health. Any questions that you maybe want to ask your dentist or ask us that you just haven't, and we can go over a few things today as well. So I'm going to give a few more minutes for people to log in and get caught up. Those of you who are already starting to come on board with this, if you'd be kind enough to kind of tell me where you're from, kind of what city. As you know, our practice has been around. Actually, my practice is a third generation. It's been in Long Beach in the Bixby Knolls area since 1924. Now, I haven't been here since 1924, but the practice was started in 1924 by Dr. Leo McBride. And he had 3 children, and 2 of his children, his sons, became dentists. So there's James McBride, and the current location where I am now was built in 1954. And I actually built this building. We redid a building in the year 2000, moved in 2001. So it's amazing that we've been in Bixby Knolls area of Long Beach, the dental practice, since 1924. So I'm very proud to be part of Bixby Knolls and to take care of our patients. About 80 to almost 85% of our patients come from our zip code. So we really are a community-based practice. So it's really great to have you here today so that we can go through some of the questions that you might have. Last week I mentioned that we were busy taking care of some of my tasks were taking care of the team, making sure that they were going to be okay here. And hello, Steve, welcome. Tell us, if you could type in, Steve, tell us what city you're watching from. That'd be great. So we took care of the team, got them settled in. We've been taking care of emergencies. The state has been very strict on what they consider an emergency, and we've been trying to honor that. We donated some masks and gowns and gloves to those in the community, including the hospital. We have also something I've really gotten pretty good at is making hand sanitizer. And I've been giving that to the local businesses around me, the bank, First Bank, and the accounting office next to me, and some other people that who've been in need of it. So there's obviously a shortage of that. So it's been fun keeping our things present for that. But the first topic I'm going to go into is, Whittier, very good. Thanks, Steve. If you have any dental questions, type them in. Anything you may have wanted to know in the past but just haven't asked, or any comments you'd like to make, that's great as well. So we're going to get into our first topic here, why some more people are starting to log in here. But I want to talk about teledentistry. There's been a lot of discussion about telemedicine. As you know, most of the practitioners and the hospitals are not seeing elective procedures, are not seeing people. They're doing it over the internet. They're doing it through telemedicine. Well, we have teledentistry. And I think teledentistry is something that may stay around after the COVID-19. And basically, we have a system where we can actually give you a link. We can actually do a HIPAA-compliant portal and talk to you about what your dental needs are. If you're having discomfort, we can assess the situation, triage it, if you will, and then we can see if we need to get you in that day. And we can also follow up post-surgery, things like that with you to make sure you're doing so. There's a great time savings for you, the patient, with that, maybe not having to leave work or have to come in for that. So it's a really great thing, this teledentistry, that has really just kind of come on out of the blue. And I think that's something that we're going to be using quite a bit in our practice going forward. I've currently used it about 9 times in the last 2 weeks. And I really think that there's so much value to doing that. So teledentistry, if you have a concern during this COVID crisis as we're shut down, if you call the office, we're actually having trouble with our phone lines today. It says that our number's been disconnected because our wonderful Frontier didn't follow through on what we asked them to do on the COVID suspension. Anyway, we're gonna get that resolved today, but if you're having an emergency, my phone number, you can get a hold of me, is 562-743-5413. Again, my cell phone is 562-743-5413. So with that, you can get a hold of me and we can actually set up a teledentistry appointment for you to help assess any of your dental needs or urgent needs that are going on. So how's that? So teledentistry is something very new here. Hi, Linda. How you doing? Thanks. She's in Long Beach. I hope you're doing well, Linda. There's a question. It says, why do I need x-rays? So that's a great question. I can't tell how many times we get this question in our office, and when I first started practicing in Northern Arizona and back when I was younger, in 1988 to 92, we took a lot more x-rays than we do now. And now what we find out with x-rays, we need x-rays because it shows what's going on in between the teeth. Sometimes when you look in, let me give you an analogy. Most of us are homeowners, and you have a house and all of a sudden everything looks great on the outside of it. And then all of a sudden you start seeing these little trailings, you know, but then as they open up the wall, you have all this major termite infestation. Well, it's the same thing with your tooth. You don't have termites, obviously, but you have a situation where something could look fine in the mouth, not detectable with our little explorer that we use to detect things. But if we see the x-ray, we can actually see a large cavity. And the whole key here is prevention. We want to intervene before something gets too large. So the main thing about x-rays is it gives us one more tool to help minimize the amount of work you may need. So dental x-rays are something that we actually tailor for the individual. We do what's called a complete set of x-rays or a full mouth set of x-rays, anywhere from 3 to 5 years on the patient. Some of that is dependent on how much restorative work the patient has already had, how many fillings they've had, you know, what's their oral health like. Somebody that has poor oral health and have had a lot of decay in the past, we're going to take x-rays more frequently, or radiographs. The other thing in there, the person who asked that question, I just read Linda's comment, that's funny. And yes, Linda, I am sitting in your chair. You're pretty wise on that. X-rays have changed quite a bit. In the past, we used a lot heavier dose of radiation, and we kind of burned the image onto film. Now we've gone to digital x-rays, which in our office is about 92% less radiation than what we took earlier on in my career. What that means for the patient is, you know, we can take 18 pictures to the equivalent of 2 old pictures. So when somebody says, well, I don't want all that radiation, you get more radiation actually spending the day at the beach or flying from LA to New York. So I want to set your mind at ease on x-rays. We take x-rays only as needed, and they really are a wonderful diagnostic tool to help us take better care of you. So that's the one thing I wanted to talk to you about on the x-rays. So I hope that answers your question. If you could do me a favor, type in any other questions you might have. I know last time we had a question on why is my child having a lot of decay? And that's something I didn't answer last time. And the question on that is we're seeing a change. We're seeing a rise in our country of baby bottle tooth decay, which is, that's a term that used to be like when I was younger, you would give a child a bottle of milk or juice to go to bed with, which is a really big no-no because of the sugar in there and the bacteria eat it and it just starts to just dissolve the teeth, the lactic acid from that. We started to fluoridate the water, and I think that's one of the best things that we could have done in our country. I know there's some people that are anti-fluoride, and that's fine. I'm not here to discuss that or debate that. But what we're finding is in this next generation, we're finding a lot of moms and dads are not giving their child tap water. They're giving them only bottled water, and most of the bottled water does not have fluoride in it. So we're starting to see an uptick in the amount of decay that we are seeing in young people, school age and even into college. And it's really a shame because we spent all these years to reduce that, and we're seeing that. So if you are giving your child bottled water, you might want to talk to your pediatrician about supplementing that with fluoride drops or what their recommendation is. Every city on their website posts their fluoride level of the water that you have from your tap. So you might want to check that, have that discussion with your pediatrician or your pediatric dentist, or you can come in and talk with us about it. We'd be happy to share that with you as well. So any other questions here? Oh, somebody's asking if I'm wearing pants. The truth of the matter is I am not. I'm wearing shorts, but I'm not going to show you that because it's awfully embarrassing. So this is 2 really good important things here that we've gone over. Another question that was asked last time that I couldn't get to due to time was, with all this time off from work, how are you going to appoint patients so that we miss the least amount of work? And that's a great question. We're working on that right now. We're trying to figure out what the protocol is going to be when we bring patients back. I think there's going to be some slight changes of how you're going to enter into the office, and we're taking temperatures. But what we're going to do is we're going to try and maximize the amount of time you are here. We're going to do more dentistry and fewer appointments for our patients. We've always tried to do that. I think my front office has been fantastic at appointing people the fewest number of times to complement their schedule, to complement their needs. One of the things our office is known for is we can do single visit dentistry. We have the technology here to do that for you. So I think that's really a very vital thing here, that we're going to try to respect your time, and also how we're going to flow patients through the office to remain safe and to be productive for not only you, but for our office as well. So I think we're going to end today on that note, and I'm going to be doing this again next Thursday for you. I want to thank everybody. If you could do me one favor, everyone who's been listening, if you could possibly share this video with all the people in your Facebook group, it would be awesome. That would help us so much. We're a business that's been shut down since March 15th, and I think the more we get out into our community, I think it's going to help us when we start back up. And based on that, I mean, I really do appreciate it. It's so great to see all of you on here. And with that, I'm going to say I'm Dr. Greg Campbell, and keep on brushing, take care of your oral health, and we'll talk to you next Thursday. Take care.